conditions that might be taken for a stroke, when in fact there's something quite different.
Something curable, you mean?
Possibly.
We're very grateful, Doctor.
I'm afraid that bed's not come up. The gentleman who's supposed to be discharged has developed a wound infection. We'll just put you over here for a moment, Mr. Crosby. Should have a bed fairly soon.
Mr. Crosby. Good news, mate. We've managed to tuck you back in and stitch you up. You see, what had happened was your ulcer had burst through your stomach wall. But we've sealed it for you. So you can just take it easy, enjoy the scenery.
Mr. Doctor started the ward round. Better get your skates on. This is the gentleman who had a foreign body removed yesterday, Mr. Doherty. Oh, you remember Mr. Doherty? The gentleman who had a thing in his bowel? A thing he'd put up there himself?
Ah. All's well, I trust.
Obs are satisfactory, Mr. Doherty.
You appear to be in the road to recovery, young man. I only wish the same could be said for your hamster. Sister, who is that young fellow who keeps following us about?
Oh, he's your new registrar, Mr. Doherty.
Ah. In the mornings, the registrar is expected to attend my colonoscopy list.
I'm no expert, Mr. Doherty, but I reckon to be able to tell a patient's ass from his elbow, so to speak.
Ah, yes. You can tell a great deal about a chap from looking up his... Of course, when he first arrived, DeVries expected to take my list. Then it was pointed out that there was no great value in having an arsehole at both ends of the colonoscope.
Mr. Crosby's not looking very well. His BP's 90/60.
Are you in pain, sir?
And my chest is...
Morphia, please, sister. We should do a cardiogram. I suspect coronary thrombosis. Connect up the defib, please.
Thank you, Stelton, Dalton. 1 to 5?
Yeah, 1, 2, 3, 4, 5. 1, 2, 3.
Clear. Who's in charge here?
Well, technically you are, Mr. D.
Well,
This chap's had major surgery and suffered a VF arrest. Kind of sounds like an MI to me.
Perhaps we should start with the 12-lead ECG. Yes, thank you, staff.
He's got bugger all breath sounds on the right.
Let's give him a pneumo with my CPR. Let's have a chest drain in here.
Trachea's shifted.
let's do something about that.
Chest compression can sometimes cause the lungs collapse, the pressure change in the chest cavity can push the windpipe over to one side. The real danger is if the heart gets pushed over there.
Yeah, that's what's just happened, so shut up and give us a hand.
Come on, roll him over. Stop thinking. Get on with it.
Okay, over.
All right.
Get him over.
Roll him over.
Ready? 1, 2, 3. Yep. Okay.
Come on, hold him stable. Stabilise him.
Secure.
Yeah. Okay, cutting out. Right. Tricard, please. Thank you. Thank you. I'm in. Cloud, please. Thank you, Mr. Doherty. Right, connected. Uncle. Thank you. Hold that.
Output recovered.
Baragwanath Department of Emergency Medicine, Johannesburg, 91. 92.
Sir, you appear to have had a slight heart attack, precipitated by the strain of major surgery.
There's no bets on CCU. I'm going to have to put him on Crippen for the time being.
Nobody expects a new senior house officer to know all the answers, you know. Except maybe that new houseman of yours.
It's pretty unusual for a house officer to look at the scans. It's clear what's behind her problems, right?
Right.
So I'll take these for reporting.
Yep.
Has anyone seen the old boy yet?
Yeah, Tony said he'll see him next. Trisha, can you take over the triage desk?
What are you two doing?
We've had an alert, major chest injuries, ETA 15 minutes. More to the point, what are you doing still here?
Thought I'd help out.
Translation. This is Raj's pitiful method of worming his way into Sister Novak's good books and hopefully into her knickers.
Dislocated finger, cubicle 2.
You done A&E before?
No?
Oh, you poor bloody lamb to the slaughter. It's like being a houseman all over again, ain't it? Except people's expectations of you are even higher. Look and learn, boy.
Hello, sir. This is the gentleman that Dr. Yates wanted admitting from outpatients, yes?
I changed some of the treatment you wrote up for him, so I thought it seemed a bit complicated.
Nothing to find on examination. May I take a look at your hands, please, sir? Fingers are clubbed. The index and middle finger are stained with nicotine. And what's this? It's a coal dust tattoo. I'll see you later, sir. You might have thought that coal was a mineral found naturally in the sheds of the working class. In fact, people have to go underground and dig it out. If they get a cut and coal dust gets inside, it discolours the wound permanently, like a tattoo. This is a man who's smoked, who's worked down the mines. I don't think it's that complicated to work out why he's short of breath, do you?
Our patient is a male in his 30s. He didn't fasten his seatbelt. He has severe chest wall injuries. James will manage the airway for us. Scissors, would you cannulate the patient, then commence fluid replacement while I perform primary and secondary surveys? Julie, would you ensure bloods are sent and x-rays requested? Nurse, if you would do an initial blood pressure measurement, please. Right. Just do as you're told. Together smoothly. James, 1, 2, 3, lift. Good.
Airway secure, breathing spontaneous.
Ready pulse. Fast fluids, please. Scissors.
Right way.
Chest exposed.
Pupils reacting equally to light.
Flail chest, multiple rib fractures. Let's get his neck fixed and x-ray skull and see spine.
I'm in.
Still not bad, Mr. Crosby.
Sister said there could be one soon.
The CT report is a brain tumour.
You see the scan yourself?
Yep.
And it was a tumour?
Yeah.
They've sent us the wrong patient's report, Phil. This is a massive infarct. A stroke. Look, we all want to impress when we start, I know. But if you don't tell me when you need help, I won't be able to help you, will I?
Yeah.
You've spoken to the family?
Yeah. Well, I mean, no, not really.
Looking after her hasn't been easy, but it's what we wanted to do.
You see, Doctor, when she became so much sicker, our doctor thought it best she come into hospital. She is very sick, isn't she?
Mr. Campbell, none of the tests have uncovered anything treatable. I think your mother is dying.
There's nothing you can do for her.
Only make her more comfortable. Would you like her to come home?
Yes, Doctor. We would.